So we're starting with the maxillary artery, and the maxillary artery is the larger of the two terminal branches of the external carotid. You can see the external carotid over here, and the external carotid has two branches, two terminal branches to be exact. We have the superficial temporal over here, it has been labeled, and the maxillary over here, and the maxillary is the bigger of these two terminal branches. Now let's look over here again and consider the area of distribution, blood distribution. And the area of distribution of the maxillary artery is quite extensive. Look at this over here. Blood supplied to the external ear, to the middle ear, and to the auditory tube. The auditory tube is also known as the eustachian tube, and that is a tube that joins the middle ear to the pharynx. Then the blood supply to the dura mater is by the maxillary artery, and the dura mater is the external-most layer of meninges. Then we have the blood supply to the upper and the lower jaws along with the teeth, and you can kind of observe this. And also to the muscles of the temporal and the infratemporal region, right? And that includes the temporalis muscle, the lateral pterygoid, and the medial pterygoid. Then we have the blood supply to the nose and the paranasal air sinuses. To the nose and the paranasal air sinuses, you can see, to the palate, and also to the root of the pharynx, right? So a couple of these diagrams, I'll be using all of these to illustrate this in the best way possible. Anyway, so for descriptive purposes, we generally divide the maxillary artery into three parts. In this diagram, the parts have been shown. The first part is also known as the mandibular part. The second part is known as the pterygoid part. The third part is known as the pterygopalatine part. And the secondary names of the divisions of the maxillary artery are pretty telling. Right, so look at the first part over here. The first part of the maxillary artery has a horizontal trajectory. The first part of the maxillary artery passes forwards horizontally. This is posterior and this is anterior. And so it horizontal forward direction, right? And it does so behind the neck of the mandible. This is the mandible. This is the ramus of the mandible. Over here is the coronoid process, which is not shown. This is the neck of the mandible, the constrictive part, and this over here is the head. So in the first part of the maxillary artery passes forward, behind the neck of the mandible, and in front of this ligament over here known as the sphenomandibular ligament. This ligament is attached below on the medial surface of the ramus of the mandible. This is the ramus of the mandible, right, and the lingula. And also notice that this is the auriculotemporal nerve, and so the first part is below the auriculotemporal nerve, right? And also this is the lateral pterygoid muscle, and this is the lower border, and so the first part is coursing along the lower border of the lateral pterygoid. Now let's consider the second part of the maxillary artery, this one over here. And the lateral pterygoid has two heads, an upper and a lower. So the pterygoid part of the maxillary artery courses upward. As you can see, this is upwards and forwards, superficial to the lower head of the lateral pterygoid. Then we have the last part, and that is a bit more difficult to understand in this particular image because we have part of the mandible removed over here, right? So I'll show you something. This part is known as the pterygomaxillary fascia, right? And this is part of the sphenoid bone, the lateral pterygoid plate, and the space, this fascia between the maxilla and the lateral pterygoid plate is known as the pterygomaxillary fascia, right? I'm hoping this is kind of making sense, right? And for you to understand what happens to the third part, you need to understand what the infratemporal fossa is. Now the infratemporal fossa is an irregular space below the zygomatic arch. Let's see if I can find an image that is showing the zygomatic arch. So this is the zygomatic arch, and the area below it is an irregular area known as the infratemporal fossa. Alright, and the boundaries. Anteriorly, we have the posterior surface of the body of the maxilla. This surface you can see from front is the anterior surface, and if you were to stand over here, the surface of the maxilla that you would see would then be the posterior surface. So the anterior boundary is the posterior surface of the maxilla, And let's talk about the roof, the medial and the lateral boundaries. The medial boundary is this part over here, known as the lateral pterygoid plate. And so any part that is more medial to the lateral pterygoid plate is then not a part of the infratemporal fossa, right? And the lateral boundary is the ramus of the mandible, which you cannot see. So it's normally like this. And so any part that is more lateral to the ramus of the mandible is not a part of the infratemporal fossa. So over here, the ramus of the mandible is shown, and this is the lateral boundary. We also have a roof, and that is formed by the infratemporal surface of the greater wing of the sphenoid, and it's not that easy to kind of appreciate that. So the first and the second parts of the maxillary artery are in the infratemporal fossa, and the maxillary artery is actually the first and the second parts are actually counted as the contents of the infratemporal fossa, along with the lateral and the medial pterygoid, right? So what happens over here is that the third part passes between the two heads of the lateral pterygoid, and then it passes over here. You cannot see the pterygomaxillary fascia, but in this one you can see, and then it passes through this pterygomaxillary fascia. And after it is done, so it is no longer a part of the infratemporal fossa, obviously. It then enters into the pterygopalatine fossa, which you cannot see in this image. This is the pterygomaxillary fascia, which leads to the pterygopalatine fossa. Now I hope all of this is very clear to you about the positioning and where you find the maxillary artery. Okay. So I will go over this again, so don't worry about that. You know what, I'll just do it right now. So we've talked about the maxillary artery as being one of the two terminal branches of the external carotid, and in this image we can see the external carotid really well. This is the external carotid, the left external carotid. This is the left external carotid, and the left external carotid has two terminal branches over here, the superficial temporal, and you should try to remember the names, and the maxillary artery. And the maxillary artery is the bigger of the two terminal branches. Now the maxillary artery, it basically arises from the external carotid artery behind which landmark? Behind this part, which is the neck of the mandible. And we divide the maxillary artery into three parts for mainly the purpose of description. The first part is known as let me show that. The first part is known as the mandibular part, the second part is known as the pterygoid part, the third part is known as the pterygopalatine part. Right, and the first part has a horizontal trajectory, as you can appreciate really well in this image. This is the first part from its origin to this yellow line over here. Horizontal trajectory between the neck of the mandible and the sphenomandibular ligament below the auriculotemporal nerve. This is the auriculotemporal nerve, and along the lower border of the lateral pterygoid muscle. And then the second part passes superficial to the lower head of the lateral pterygoid, and so the second part is known as the pterygoid part of the maxillary artery. The third part, basically it's not going to be in the infratemporal fossa, because first it's going to pass between these two heads of the lateral pterygoid, and then through this pterygomaxillary fascia and enter into the pterygopalatine fossa. And hence, because it is no longer a part of the infratemporal, no longer a content of the infratemporal fossa, the third part is known as the pterygopalatine part. Alright, now let's consider the branches, etc. So first thing to remember is that the first part has a total of 5 branches, the second part has 4 branches, and the third part has 6 branches. So we have 5, 4, and then 6 branches. And the names are extremely important and they're often asked. So it is critical that you do not underestimate the importance of this. Alright, so what are the branches? So we start with the deep auricular branch, right? And then we move towards the anterior tympanic, then the middle meningeal, then the accessory meningeal, and then the inferior alveolar. Now over here you're going to be confused. It is quite logical that you would be, so I'll show you this sort of an image first. Right, so this is where it arises, and what is the first branch? The deep auricular. The auricular has to do with the auricle, deep auricular, anterior tympanic, tympanic has to do with the tympanic cavity. And these are just ways to remember. The middle meningeal, and then the middle meningeal, and then the accessory meningeal, right? And then we have the really big one, which is the inferior alveolar, and you can see the inferior alveolar really easily, right? And the names are the most important, and people can figure out various different ways to remember it. The easiest way to remember is that we have two meningeal, the accessory meningeal, and then we have the middle meningeal. We have one that is named for the ear, the deep auricular. My apologies. We have two that is named for the ear, the deep auricular and the anterior tympanic. Auricle for the pinna, and the anterior tympanic for the tympanic cavity / middle ear cavity. And the last one is the inferior alveolar, because we know the jaws, as I've mentioned at the start of the video, also receive the blood supply from the maxillary artery. And so over here, we do have the foramina transmitting labeled over here. So let's start with the inferior alveolar. There's something known as the mandibular foramen, right? I'll basically show that one to you. Right, so let's talk about the foramina, starting with the deep auricular and the anterior tympanic, both of which are named after the ear. So the deep auricular passes through a foramen in the floor of the external acoustic meatus, and that is the squamotympanic fissure between the squamous part of the temporal bone and the tympanic plate. So we have this fissure, the squamotympanic fissure. For the anterior tympanic, there is something known as the petrotympanic fissure. Again, this is between the petrous part of the temporal bone and the tympanic plate. So easy enough to remember. Deep auricular and the anterior tympanic branches have something to do with the ear, and so the fissures that they pass through in order to enter the cranial cavity are between the parts of the temporal bone and the tympanic plate, right? So we then have the middle meningeal and the accessory meningeal, which have to do with the supply of the meninges. Now, foramen spinosum and foramen ovale are important foramens in the greater wing of the sphenoid. And when you did the foramen ovale, you would have probably done the mnemonic male for the contents, and the A stood for accessory meningeal. And when you probably did the foramen spinosum, you also did a mnemonic MEN, where the M stood for middle meningeal. The inferior alveolar, on the other hand, has a foramen. I'll show you. That is the mandibular foramen. Let me show you. I guess it's not over here. But basically, the mandibular foramen is located on the ramus of the medial surface of the medial surface of the ramus of the mandible, right? And it basically passes in a canal in the mandible and exits out from another foramen located on the anterior surface of the mandible near the midline, known as the mental foramen, right? So it basically enters somewhere over here. Somewhere over here, there's the mandible. There's the mandibular foramen, and then it exits out over here at the mental foramen. So let's consider the details. So what was the first artery? What was the first branch? That was the deep auricular branch. What was the second? That was the anterior tympanic. What was the third? The middle meningeal. The fourth, the accessory meningeal. The fifth, the inferior alveolar. Let's see over here. External carotid, maxillary artery, we have the deep auricular, and then we have the anterior tympanic. So it's the same thing shown over here. The two branches. Over here we have the maxillary artery, as you can see, and then we have labeled the middle meningeal artery as well. It's very interesting. These two are the ones you should be concerned with right now. They're probably, because you can see it's going to supply the external acoustic meatus. Distribution, deep auricular. Skin of the external acoustic meatus and outer surface of the tympanic membrane. The tympanic membrane has an outer surface and an inner surface. So the skin of the external acoustic meatus, which basically lines the inside, and the outer surface of the tympanic membrane, both receive their blood supply by the deep auricular. Then we have the anterior tympanic, which enters via the petrotympanic fascia, right? And that one supplies the inner surface of the tympanic membrane. So the outer and the inner surface, both of them are now accounted for, right? I'll do this again. For now, you have to consider this one over here. This is deep auricular, this is anterior tympanic. What is this one then? Middle meningeal, accessory meningeal. This is the middle meningeal, and this is the accessory meningeal. And the middle meningeal, as labeled, enters via the foramen spinosum, right? Because you should be able to tell that, as I've already mentioned, the roof of the infratemporal fossa, where the first and the second parts of the maxillary artery are coursing, is formed by the infratemporal surface of the greater wing of the sphenoid. And I've already said the foramen ovale and the foramen spinosum are located at one of the borders of the greater wing. So since this is the middle meningeal, so this makes it the foramen spinosum, and this is the accessory meningeal, so this is the foramen ovale. Observe this one over here. I'm hoping all of this really makes sense. And what is the middle meningeal supply? Supplies more of bone and less of meninges, interestingly. Also fifth and seventh nerves, the middle ear and the tensor tympani. So the middle meningeal does supply the middle ear, middle meningeal, middle ear. Tensor tympani is one of the two important muscles located in the middle ear cavity. Also the fifth and the seventh nerves, the trigeminal and the facial. So more of the bone is supplied than anything else. Then we have the accessory meningeal. Main distribution is extracranial to the pterygoids. Extracranial means the ones that are not inside of the cranial cavity. So the accessory meningeal is probably supplying the pterygoid muscles more than anything else. Inferior alveolar to the lower 8 teeth and the mylohyoid muscle. Right, so why? Because you can see this is the inferior alveolar, and you can really see that it is supplying these teeth. And which is the mylohyoid muscle? It is a muscle that takes origin from this curved ridge on the inner surface of the mandible, and so it does kind of make sense that it would be supplied by it as well. Let's do some details. Let's go over the branches again. The deep auricular artery supplies the external acoustic meatus, the skin of the external acoustic meatus, the outer surface of the tympanic membrane, and supposedly the temporomandibular joint as well. The anterior tympanic branch, you cannot see these two over here, but you can see them in this one. The anterior tympanic branch supplies the middle ear, including the medial surface or the inner surface of the tympanic membrane. The middle meningeal artery, which is this one over here, lies between the lateral pterygoid and the sphenomandibular ligament, then between two roots of the auriculotemporal nerve, enters the skull to the foramen spinosum. Right, this is actually clear because this is the mandibular nerve, right, coming out of this same foramen ovale that the accessory meningeal is entering via. So the middle meningeal artery is then between two roots of the auriculotemporal nerve. I've already mentioned the auriculotemporal nerve. So this is the auriculotemporal nerve, and we have two of its roots over here, and so the middle meningeal artery is lying between the two roots. Enters the skull through the foramen spinosum to reach the middle cranial fossa. Right? So when it does that, when it enters through this foramen spinosum, what it reaches is the middle cranial fossa. It's the same for the foramen ovale as well. And then it divides into a large frontal branch which courses towards the pterion, and a smaller parietal branch. The pterion is basically where four bones meet. Right? So the middle meningeal artery has been described, lies between the lateral pterygoid and the sphenomandibular ligament, and the rest of the stuff I've already told in detail. Now we talk about the accessory meningeal artery. The accessory meningeal artery enters the cranial cavity through the foramen ovale, as you can see. Apart from the meninges, it supplies the structures in the infratemporal fossa. So middle meningeal, I've already mentioned, more of bone, less of meninges, the fifth and the seventh nerve, the middle ear and the tensor tympani. The accessory meningeal is the main distribution is extracranial to the pterygoid, as already mentioned. Apart from the meninges, it supplies the structures in the infratemporal fossa, which structures are apparently the pterygoids. So the supply to the meninges is not that important. And same thing was with the middle meninges, which was supplying more of bone, less of meninges. Also the fifth and the seventh nerves, part of the middle ear, and even a muscle in the middle ear known as the tensor tympani. The inferior alveolar is supplying the lower 8 teeth and the mylohyoid muscle. So let's move towards the second part. This is the external carotid. This is its branch, the superficial temporal. This is the maxillary artery. This is the inferior alveolar artery, which is a major branch. Enters the mandibular foramen, courses in the mandibular canal, comes out of the mental foramen. Then we see the middle meningeal artery and the accessory meningeal arteries. These are the ones that are labeled because they are more important, right? And the middle meningeal artery lies between, and you can see it is passing behind the lateral pterygoid, between the lateral pterygoid and the sphenomandibular ligament. And in this one, you cannot see that it passes between the two roots of the auricular temporal nerve, and then near the foramen spinosum, it enters into the middle cranial fossa. You also see the accessory, and you see the second part over here. So the second part has a total of four nerves, and two of them are labeled after the muscle of mastication: the mesenteric artery, the pterygoid artery, and one of the muscles of the temporal fossa, the deep temporal artery, and we also have one that is the buccal artery. So we have four of these. Let's see if we can find something interesting. So this is basically more for the third part than anything else. Let's see. So what are the branches that come off? We have the mesenteric. We have the mesenteric. This one is the mesenteric. We have the pterygoid. We have the deep temporal, and these are the easiest to kind of like recognize. And then we have the buccal. We have the pterygoid. We have the mesenteric. We have the deep temporal, and then we have the buccal. So let's look at these again. We have the pterygoid branch, the mesenteric branch, the deep temporal branches, and the buccal branch. And they're not basically passing anywhere because they're going to be supplying the muscles over here. So the mesenteric is going to be supplying the masseter, the deep temporal is going to be supplying the temporalis, the pterygoid is going to be supplying both the lateral and the medial pterygoid. The buccal, on the other hand, will supply the skin of the cheek. So nothing there. Now we're going to have 6 branches of the third part. This is going to be interesting, right? So let's see which are the branches, right? So we start with the posterior superior alveolar. In the first division had the inferior alveolar, the third has the posterior superior alveolar. Then we have the infraorbital. Then we have the greater palatine. Alright. Then we have the pharyngeal. The pharyngeal is over here. Then we have the artery of the pterygoid canal over here. And then we have the sphenopalatine, which is actually the terminal part. This is the sphenopalatine, which is the terminal part. So let me show you another diagram. So let's consider the branches over here. We have the posterior superior alveolar, and this one is labeled over here. This is the third part, and this one is the posterior superior alveolar. And we also have the infraorbital. This is the infraorbital, and we have the sphenopalatine. The sphenopalatine is over here, which is actually a terminal part. So it's kind of like going like this, and so this is the terminal part, the sphenopalatine. It has an infraorbital, a posterior superior alveolar. We have a greater palatine, right? We have a greater palatine, and we also have the pharyngeal and the artery of the pterygoid canal, not shown over here. Let's look at this again. This is showing the trajectory better than the first one. We have the sphenopalatine, which is seen as the terminal branch with the artery of the pterygoid canal. I'll show you something over here. Right, so this is the one that's entering into the pterygoid canal, right? And this is the sphenopalatine. Then we have the infraorbital. Then we have the pharyngeal. Then we have the posterior superior alveolar. Then we have the greater palatine. Now we talk a little about the various branches of posterior superior alveolar. So foramina transmitting it, alveolar canals in the body of the maxilla, right? So that's interesting. And it is going to be supplying the upper molar and the premolar teeth and the gums, as well as the maxillary sinus. So the gums, the upper molar, and the premolar teeth. Upper molar means of the upper jaw. Right, and then let's see the branches. So starting with the posterior superior alveolar, which is labeled over here, it is going to be going via the alveolar canals in the body of the maxilla. going to be supplying the upper molar and premolar teeth and gums maxillary sinus. The posterior superior alveolar artery arises just before the maxillary artery enters the pterygomaxillary fissure. So just when it's about to enter, this is the one that comes off, and it descends on the posterior surface of the maxilla, the one that is facing behind, and gives branches that enter canals in the bone to supply the molar and the premolar teeth and the maxillary air sinus. Alright. Then we have the infraorbital artery, which is the one labeled over here, also a major artery. Also rises just before the maxillary artery enters the pterygomaxillary fissure, as you can see. It enters the orbit to the inferior orbital fissure, which is very important that the infraorbital artery is entering into the orbit of the eye via the infraorbital fissure. It then runs forwards in relation to the floor of the orbit, as you can see. This is the floor of the orbit, right? First in the infraorbital groove, and then in the infraorbital canal to emerge on the face with the infraorbital foramen. I'll be showing you images. This is the infraorbital foramen, and the infraorbital artery has now emerged on the face. Previously it was in the groove and then it was in the canal, and I'll be showing you the images, so don't worry. It gives off some orbital branches for structures in the orbit, middle superior alveolar branch for the premolar teeth, and the anterior superior alveolar branches that enter the apertures in the maxilla to reach the incisor and canine teeth attached to the bone. So what are the areas supplied by the infraorbital? Lower orbital muscles, the lacrimal sac, the maxillary sinus, the upper incisor, and the canine teeth. The infraorbital artery also arises just before the maxillary artery enters the pterygomaxillary fissure, enters the orbit through the inferior orbital fissure, you cannot see, runs forwards in relation to the floor of the orbit, first in the infraorbital groove and then in a canal, emerges on the face. This is the face with the infraorbital foramen, gives off some orbital branches. The structures in the orbit, as I mentioned, the lower muscles as well, the middle superior alveolar and the anterior superior alveolar, right? And the middle superior alveolar branches for the premolar teeth, and the anterior superior alveolar branches that enter the apertures in the maxilla to reach the incisor and canine teeth. After emerging on the face, the infraorbital artery gives branches to the lacrimal sac, located laterally, the nose and the upper lip. Lacrimal sac, my apologies, the lacrimal sac over here, the nose and the upper teeth. The remaining branches of the third part arise within the pterygopalatine fossa, and the rest of the branches are going to be within the pterygopalatine fossa. The greater palatine artery runs downwards in the greater palatine canal. I'll be completing this chapter in the next part of this video.